Okay, so picture this. You walk into a patient's room wearing gloves, but now they're coughing, and your nose itches. Do you scratch your nose through the gloves? Leave the room and decontaminate? Panic and run to the nearest hazmat suit? Or wonder why you didn't take this video more seriously? Welcome to Infection Control. Let's save your skin and your license. Are you ready? Let's go. Standard precautions. Everyone, every time. That's what you want to categorize it as, because standard precautions are your baseline safety moves. Hand hygiene before and after every patient contact. Gloves for contact with blood, fluids, mucous membranes. Gown, mask, face shield when there's a risk of a splash. So here's a funny truth to remember. If you wouldn't touch it with your bare hands in real life, don't do it on the NCLEX. So pro tip, alcohol-based hand rubs is usually preferred unless hands are visibly soiled. Then it's soap and water time. So let's get into transmission-based precautions. Know your bugs. Well, the precaution type, key bugs, and PPE required is what breaks it down. Because precaution type contact for MRSA, C. diff, and VRE. And what is your PPE? Gloves and gowns. For droplet, influenza, mumps, and pertussis. And what is your PPE? A surgical mask. Airborne, TB, measles, varicella. And what's your PPE required? An N95 respirator, negative pressure rooms. So here's an NCLEX tip. Chickenpox equals airborne and contact. Always double check for those combo bugs. All right, let's get into PPE order, donning it and doffing it. So how do we don it? Well, we go gown, mask, goggles or face shield, and then gloves. And then doffing or removing the PPE, it's gloves, goggles, gown, and mask. How do we remember this? Well, try this. Think, woo, I get PPE to protect me. All right, you're gonna go from bottom to top. Gown, mask, goggles, gloves. And then to take it off in alphabetical order. Gloves, goggles, gown, and mask. It's an easy and quick way to remember how to protect yourself with your PPE. So now, what are our safety must-knows? Fall risk, alarms, ID checks? Well, let's start with ID bands. Always use two identifiers, name and date of birth, not room number, name and date of birth. Fall precautions, yellow socks, bed alarms, low beds, call bell is within reach, and restraints. Use only as a last resort. They must have a provider's order and renew the order every 24 hours. Remove restraints every 2 hours for assessments and range of motion. Here's a quick reminder. Restraints are actually a safety risk, not a solution. Only use them if there's real danger or potential harm. So now getting into infection control for procedures, well, Foley catheter insertion, sterile gloves, and a sterile field. Wound dressing changes, clean versus sterile, depends on the order and the wound type. Central line care, sterile, technique, every time. No variations. So here's an NCLEX favorite. Don't touch the sterile field. Don't even breathe on it. If you question the field's sterility, you start over. You don't just go, it'll be okay. No, start over. It's for your patient's safety. All right, let's get into a biggie. C. diff and hand washing hell. Because in C. diff is contact and soap and water only. But why? Well, alcohol doesn't kill the spores. It's soap, scrub, and maybe a prayer. So let's get into an NCLEX style question. What action by the nurse requires intervention? Wearing gloves to empty a Foley, removing gloves after leaving a C. diff room, using alcohol-based sanitizer after removing gloves in a C. diff room, and disposing of PPE in the patient's trash bin. Take a moment, write down your answer. Well, in this case, the spores are not killed by alcohol, so the answer is C, because using an alcohol-based sanitizer with C. diff doesn't do it. We must wash our hands with soap and water. D is also not a good one, because PPE goes in biohazard, not a regular trash bin. If you got either one of those, good job. This is a double red flag. Here's a nursing gold nugget. The NCLEX is obsessed with safety. If there's an answer that prevents infection, identifies the patient, reduces harm, or requires assessment, it's probably the right answer. So, infection control isn't just a protocol, it's a mindset. Think sterile, act clean, and never touch your face. Great job. You're halfway to NCLEX glory. And next up, we're diving into pharmacology, the top 30 must-know meds. Because if you're going to pass, you need to know your insulin from your digoxin. Great job. Go do a couple practice questions. I'll see you right back here for the next video.